Hi, my name is Amanda Wilbur. For my vulnerable population this semester, I chose intellectual disabilities. This is mainly because I worked with people with disabilities for close to 10 years. Many of these had intellectual and not just physical, and I helped them find employment. I saw the struggles that they encountered on a daily basis, and it's something that is important to me, and I'm excited to dig a little deeper this semester into it. So, an intellectual disability is defined as someone that has decreased cognitive function, which can limit their function in their daily life. There's less severe and more severe in this, so each person is variable. The health disparities that they typically see is more chronic illnesses, which that might be because they have a lack of education, so which decreases their income, and maybe they don't get to their health services. Maybe they have lack of resources because they are confined to a population of intellectual people with intellectual disabilities. There's a lot of different variables that go into it. Population size. So Utah is right among average. So 2% of the population in Utah has an intellectual disability. And according to Special Olympics, 1 to 3% is the average on a global level. So Utah is right smack in the middle there. Social determinants. So all five of the social determinants, which are education, living, healthcare access, social and community, and economic stability, all of those could present a barrier for those with intellectual disabilities, and probably typically do from my personal experience. Education, they have different, they can have a different type of learning style, or maybe they don't learn, a traditional classroom setting that we would see in high school and college might not work for them. So that creates a barrier for them to get continuing education. Their living environment. So with lack of education or employment opportunities, they typically are low income. I have seen some that have families that have come from a wealthier population, and but those are few and far in between. Most of them that I have encountered are very low income. Because of that, they live in communities that are also low income. And a lot of them will live in even smaller communities that are with those others that have disabilities. So they're kind of in their own little bubble of being with people that with disabilities a lot of the time. Their access to healthcare, that typically can be decreased. Maybe it's from transportation because they don't have their own vehicle, because of the lack of education and their low income status. They don't seek out medical needs for a lot of different purposes. Social and community, they may be limited to their own neighborhood, like I previously stated. They're kind of in their own little bubble. So this can be hard for them to meet and interact with those people that do not have disabilities. And then economic stability. With lack of education and job opportunities that are a little bit more um, not as prevalent for them, their economic stability is usually not stable. One of the contributing factors to the health disparity comes back to money, and there are many of them, but I chose to look into the low income factor, and that maybe unemployment is something for the reason behind this. So, according to an article I found, 50 to 70% of people that have disabilities are unemployed, which that's on a global scale, and that is a lot. That's a majority of their population. So I'm thinking, if they're unemployed, why are they unemployed? Why are they not able to find employment to make that money and, you know, which could help them get the health care that they need? So, my first step is I looked, okay, well, they can't find a job. Well, why is that? Maybe it's because they have poor work ethic and they're inconsistent, and maybe they've gotten fired before, and maybe they have a poor resume. Um, Going from that, well, why do they have poor work ethic? Why are they inconsistent? Well, maybe because they're insecure. Maybe people at their work sites don't make them feel comfortable, so they don't work at their optimal ability while they're there. Well, why are they uncomfortable at their work sites? Maybe they were teased throughout their life. Maybe their disability has created a barrier for them and between them and others. Why is that happening? Maybe they were shy in school, so maybe now it's hard for them to branch out and meet people. And all of this could go by, well, why are they shy? Well, maybe there was abuse in their home. And I wanted to bring this up because abuse, people with disabilities are 7 times more likely to experience abuse. They typically do. From family, from non-family, from people they trust, from people they don't know. They have the highest rate of abuse out of any population in the United States. So the root cause of somebody being unemployed and maybe not seeking health, seeking or going to the doctor might be from their underlying abuse that they experienced as a child. This is just one thing that I looked into, but it would make sense, and it is something that I personally have seen occur within this population. So Maslow's hierarchy of needs, again, all of the levels can affect somebody with disability, can struggle with these levels. Physiological, maybe, shopping for food, clothing, bills, safety. They might need help in their homes, making sure that they have the right assistive devices to remain safe within their home and the community. Love and belonging. Maybe they need assistance to finding opportunities to socialize and interact with other people outside of their bubble. Esteem. So people with intellectual disabilities have been found to have lower self-esteem than other populations. And self-actualization. Assistance may be needed to set goals that provide purposeful results so the individual can achieve their dreams. Specific concerns for communicable diseases. So this is interesting because communicable diseases often cause these intellectual disabilities. So these listed here could be reasons why the person is disabled, and because of this, they are at a higher risk to be throughout their life due to education, housing, nutrition, and then non-communicable diseases. So there's an increase in prevalence of non-communicable diseases with people with disabilities. Non-communicable diseases are cardiovascular disease, diabetes, cancer, MS, chronic respiratory disease. So people with disabilities increase the risk due to decreased perception of when to seek healthcare, difficulty utilizing healthcare services in place, and decreased access to transportation and location. So self-care, according to Shannon T, individuals with disabilities are higher risk for self-injurious behavior. This typically can be seen with headbanging, biting, self-rubbing, and scratching. Interventions, a physical assessment needs to be done to see if there's any underlying cause, and a social worker should be involved. Risk for harm by others. So according to CDC, people with developmental disabilities are not more aggressive than anybody else, but sometimes they can seem that way because of their frustration and their self-injurious behaviors. It might seem that they are aggressive, although the injury is to themselves and not others. And so that's important I think it's a misconception of this population. I hope I covered everything, and I hope this technology, it's my first time using this, so bear with me, but thank you, and I'm excited to keep looking into this vulnerable population that's really important. Thank you.